Outpatient therapy is a powerful tool, but what happens when it simply stops being enough? Delaying more intensive treatment doesn't save time. It leads to severe symptoms and a higher cost of crisis. The need for more help isn't always a dramatic breakdown. Sometimes it's a quiet, persistent struggle. You can attend every session and take every pill, yet still find your symptoms getting worse. That is a sign. We will now break down the signs you need more support, from subtle plateaus to non-negotiable warnings. First, let's address the most common category, the plateau problem. This isn't a bad week, but a pattern. One sign is consistently struggling between sessions. You feel okay for a day, then fall back into crisis mode. Another is a feeling of being fundamentally stuck, despite months of effort. The current approach isn't working. You also rely more on negative coping, like isolation or substance use. The outpatient tools are being overwhelmed. These feelings of being stuck are powerful internal indicators. But what happens when the illness affects your daily life? A major external sign is a significant decline in daily functioning, struggling with hygiene, work, or basic tasks. Let's return to coping skills. Why is the failure to use them so significant? It signals a gap between knowing and doing. In the therapy room, a strategy makes sense. In the real world, distress is too high. A higher level of care bridges that gap. This is why functional decline matters. When you can't perform daily activities, the illness is overpowering your life structure. A person's mental health does not exist in a vacuum. Your environment and support system form a sensitive ecosystem. Have you ever seen a friend changing in a concerning way, even when they insisted they were fine? That observation is data. Reports from family and friends are vital indicators. They see the gap between what a patient says and how they actually live. What might they see? First, dramatic and persistent changes in physical routines, like severe insomnia or sleeping constantly. Next, profound social withdrawal. This is a complete loss of interest in hobbies and people, a condition called anhedonia. Finally, look at healthcare interactions. Frequent crisis calls or repeated ER visits show the outpatient plan has failed. This becomes even more pressing with co-occurring disorders, like anxiety and substance use, where integrated intensive care is needed. We have covered signs that the current plan is insufficient. Now, we must discuss the warnings that demand immediate action for safety. The number one critical sign is any suicidal thought, plan, or self-harming behavior. This is a signal of unbearable pain. Outpatient therapy cannot provide the 24/7 observation needed to keep someone safe. An inpatient setting is designed for this acute risk. Another critical warning is the onset of psychosis, paranoia, hallucinations, or delusions. This indicates a break from reality. But here's a surprising fact. Inpatient care isn't just for acute crises. It can be a reset button for those who are stuck. This reset removes environmental triggers and daily pressures, providing the space to focus completely on recovery. We started by saying delaying care has consequences. Those frequent ER visits are the direct result of that delay. We also noted the family ecosystem is vital for spotting a crisis. Poor discharge planning breaks this link, raising readmission risk. This is not a simple choice between therapy and a hospital. A full continuum of care exists to match the right level of support. Knowing these signs is the first step. So, how do patients, families, and providers use this knowledge to change outcomes? We've covered three key areas: the plateau problem, where progress stalls, the ecosystem effect with undeniable behavioral signs, and critical warnings, where safety is the immediate priority. Recognizing these signs early is the key to preventing a crisis. The objective is not to stay in high-level care forever. It's to use it strategically to build a foundation for a successful return to life. If you recognize these signs, talk to your provider. Advocating for the right level of care is advocating for recovery.